going to spend our time together this afternoon sharing some brief context and background about how this report and initiative came to be. We'll do a bit more of a deeper dive into the outcome and measures, more so than we did for the folks that were on the first webinar. We really want to spend a little bit more time on them. And then we want, in partnership with you, we want to have a conversation around the adoption strategies and considerations. So we just want to tease out some of the themes that we know are important when we are considering integrating these measures, and what are some of the challenges that we can, over the next couple of months, work together to address. So with that, let's begin with some opening remarks from Sherilyn Adams. Sherilyn is the Executive Director of Larkin Street Youth Services in San Diego, California, and was also one of the Measuring Up Steering Committee members. And as a service provider, we are glad that she can join us this afternoon to just share a little bit about her reflections on what this report and the recommended outcomes and measures means for Larkin Street, means for the systems planning work going on in her community. What are some of the measures that Larkin Street might be thinking about integrating? And what are some of the considerations for adoption that they'll have to kind of work through as they move towards integration? So Sherilyn, thank you so much for joining us. I'm going to pass the mic to you. And thanks for just setting the tone about the so what around this set of recommendations and measures.
Thanks, Josephine. And just one, I think Josephine has San Diego on her mind, but Larkin Street's in San Francisco, although San Diego is an awesome place. So thanks very much, Josephine. Can somebody just signal if they can hear me? Maybe. Am I good?
You sound great. Yep, you sound great.
Okay, thanks. You never know if you're just talking to yourself on a webinar. So thanks, everybody. Super excited to be on the webinar and super excited about the report and the work that everybody's put into it. Kudos to Matt and to Megan and to the team at Chapin Hall and at Youth Collaboratory and everybody else that participated in doing this work. It's super exciting. And I think what for me is exciting, Larkin Street's been collecting outcomes for a while. We have a strong belief and understanding. Our impact has really driven our work driven our work here locally or within Larkin Street, and that this report sort of confirms the ways in which we've been thinking about or how we do our outcomes, what we think is important to understand about impact, how we're tracking the information that we're tracking, and the assessment tools that we are using. This report certainly confirms that work that we've been doing, and we will continue to look at use the report as a basis for understanding how we can continue to improve and the measures and the outcomes in the report. Now we can improve the work we're doing within Larkin Street to look across all of these key areas for young people. And it's super awesome to me that this builds on the work that's been happening at the West Coast Convening and lots of other places where we're trying to really look at both outcomes for young people relative to individual providers, but also I think the system level shift and change this can make. And so for us, I think the other way one of the most important ways that we want to be able to use this report and to use the measures and the outcomes is to really help as we are building out our system here in San Francisco. We've set a goal of reducing youth homelessness by 50% by 2023 as a city. And I think one of the ways, both in the absolute numbers, do we reduce by 50%, but also integrating these measures into our understanding of what youth are achieving along those stability, education, employment, and fostering connections, and using this report as the way to sort of inform and influence policymakers, others, funders about how we need, but this is the ways in which we need to be measuring these outcomes and know that our impact that we're having on young people beyond moving them into housing. So for us, this just gives us such an important tool in doing the system level change that we seek to do, that all of us seek to do. And then I think with this sorts of framework, we will be able to really move the needle in communities and beyond towards having a shared understanding of the impact that we're having on the lives of young people with valid measures and sort of being able to speak from with a more consolidated voice, if you will, in our work with young people. And I really believe that we should know if what we're doing is having an impact on young people's lives, because, you know, that's our sort of responsibility as people helping to facilitate their path and their journey. So I'm excited and just glad to be here, and thanks to all for the incredible work that you have all done.
Thanks so much, Sherilyn. We look forward to working with Larkin Street and San Francisco and all the other communities that are really working to strengthen not just our program level impact on young people, but the way in which those outcomes and measures roll up into some of all the systems work that's happening across the country. So thank you so much. All right, I'm going to pass it on to Megan Blondin, who is going to just remind us again where this work comes from and the approach that we took to get to where we are. So Mike's yours, Megan.
Great, thank you, Josephine. So I'm going to, I know that a number of you were on the call, our first webinar, where we provided an overview of those measures. And I know that there's also a large contingency of people on this call today who were not part of that webinar. So I have just, I don't know, 4 or 5 slides here that I'm not going to go into as much depth of the background as we did in that first webinar, but we did want to at least provide some level setting so we're all on the same page moving forward. So here's the federal framework to end youth homelessness. I imagine most of you are familiar with this at this point. It was created by the U.S. Interagency Council in partnership with a number of federal agencies. And one of the important pieces of this framework, what it did for the field, is that it defined the 4 core outcome areas. And as Sherilyn pointed out, the significance of that is that it pointed out in order to solve for a homeless experience, it's more than just about housing, but it also includes things like permanent connections, social and emotional well-being, education or employment. And so it brought us from, it outlined 3 more areas beyond stable housing and provided common definitions. So now now the field knows that we're concentrating on more than just housing, these 4 core areas. We have some common definitions on what each of those core areas were, but the issue that remained is that there were not common measures or there was lots of questions about which measures should programs or organizations be using within these domains or areas. That was complicated by the fact when not all programs are the same, right? So what a drop-in center or street outreach program might use is drastically different than what a transitional living program might use. So there was lots of questions. I equate it to the Wild West sometimes, and the result of that is that it limited our ability to use this information. It limited our ability to use this information within programs, also at the system level, and also at the national level. It limited our ability to look across programs and make adjustments, be able to utilize that information. The other thing we want to share with you before I go into the measures, and this is less of a background, more of a clarification piece. This is also included in the report, is the terms that we use throughout this webinar and throughout the report. So we'll refer to those 4 core outcome areas as areas or domains, and these are really the broad thematic areas like permanent connections or stable housing. The outcome is the construct that can be measured that the interventions can influence. So It is the measurable piece that services influence. And the indicator is the evidence that the outcome has or has not been achieved. The measure here is the specific data collection tool. So what is the scale, survey, observation, protocol? And I want to point out that sometimes your funding announcements, for example, might use these terms slightly differently. So this is why we are outlining them here, so that when we say measure, you're clear what we are talking about. It's important to note that these measures that were identified were not done so in a vacuum. So in addition to a fair bit of research that went into this from the Voices of Youth Count evidence review, and also looking at surveys of providers and funded grant applications from providers. We also tapped into the larger stakeholders within the field. Our intention here was to promote consensus across the field, and in order to do that, you have to include those voices. So you'll see here there's a number of consultation groups that participated in identifying and winnowing down what are the essential elements that we want to get across in each of these core outcome areas, and then ultimately choosing what those measures are. In addition to these consultation groups, there was we utilized a steering committee or a leadership body, which pulled together groups from practice, philanthropy, research, and federal agencies, among others, to go a little bit deeper with us, sort of get into the weeds with us. So we drew on their expertise as well. And and in our research, and then also what we asked of our consultation groups and steering committee members when they were helping us to refine these measures, this was the criteria that we were using. So the domain, does it clearly fall under the domain core outcome area that we are that we have identified? Is it relevant? So does it support the outcome of ending youth homelessness? Does it have a clear measurement tool? Is there any evidence that it is valid or reliable? And feasibility. So Matt, is feasibility where cost was a factor?
Cost and time, yeah. Making sure that the measure is available in the public domain, that is free of cost so that anyone can access it, and it's not excessively long so that it can be readily implemented across different systems and programs.
Great, thank you, Matt. So we are going to, that is a little bit about the background of how we came up, how these measures came to be. Before I pass it over to Matt, I just want to give your attention to a couple of things, because on our last webinar, people had a number of questions. I am quite sure most of you have seen the report by now. If you haven't, you can see that on our website. And in the bottom right-hand corner, you'll see the files to download box. You can also download it directly from that box by clicking on the name and clicking download files. When you go to the website, not only will you see this report, but you will also see this table in a slightly different format. And this, let me just pull it up a little bit bigger here for you. This table is a quick link, a quick click table for you to be able to access all of the core measures that are recommended. At the bottom of this, at the bottom of this chart, so this is both in the report and on the website, you'll see an example instrument for core measures. So, and I'll pull that up for you what that looks like. And so what we've done with that instrument is, in addition to the individual measures that you can draw on, we've put all of the measures into one example tool if you were interested in doing these all at once. And we sort of walk you through where you would include consent information, any background information that currently exists in your screening and assessment processes, and prompts that go along with, that could potentially go along with each of the core outcome measures. And then the last thing that I want to point out that's a tool or a resource on the website is that each of the measures also has this overview page. And so here you will see the title of the measure, the core outcome area that it addresses, in this case social and emotional well-being. The overview section tells you the purpose of this measure, the target population, if there is one, what the length of the instrument is, how it is measured, the developers or the source of the measure, any psychometrics. Sometimes there's more things. This one's super short. Any information that is good to know, and where you can go to learn more information if you want to dig deeper in each of those. So I just wanted to share those with you so you're aware that they are available. And with that, I will pass it off to you, Matt, to walk us through those, what those outcomes and measures actually are.
Great. Thanks so much, Megan, and thanks to everybody from across the country for joining us in this conversation about these newly released core outcome measures for youth experiencing homelessness, and especially for the work that you're doing across the country to drive change and impact towards improving all of these outcomes for youth experiencing homelessness. So thank you very much. I'm not going to go much into the methods of the work. We did that in the last time around, and I'm seeing that it's a little bit difficult to hear me. I'm going to try to change the audio setting. 1 second.
Mm-hmm.
Is this better to hear me?
Much better, Matt. Thank you.
Okay, great. So I'm not going to spend much time on the methods behind the Youth Outcomes project. We did that last time around, and there is further information in the report itself, but we'd be happy to answer any questions. But really what I want to do is provide an overview of the outcomes and the measures that were selected. And just a reminder about the slide that Megan had raised earlier. When we say outcomes, we mean the construct that we're trying to measure within a broad domain like social emotional well-being. Or permanent connections. So for permanent connections, you could go about measuring social capital, social networks, social supports, positive connections, and so on. And within each of those outcome constructs, you can measure those outcomes in different ways. So that's what we mean when we say outcomes and measures. Outcome is the construct within the domain, and then the measure is the tool that we're using to measure that construct. And before I provide an overview of the outcome measures that we've prioritized in this exercise, I just want to reinforce that these are not measures that we just selected on our own. These were measures that were selected based on a rigorous evidence review from the literature, a significant review of federal program proposals, and a review of what various providers are using as outcome measures currently in the field. And maybe even more importantly, we conducted consultations across the country with youth with lived experience of homelessness, with service providers, with continuum of care data leads, with federal data officers, and so on, to be able to get their insights on what we should be thinking about as we go about selecting appropriate outcomes and measures for the nation to use commonly around youth homelessness. And these consultations yielded incredibly important insights, and I just want to give a few examples of that to give you a little bit of a flavor of how these qualitative insights from the consultations influenced our thinking. So this one, for example, is about social emotional well-being. This is, I believe, from a young person who we spoke to, who said there are a lot of outcomes in this domain, so if I had to choose, I would lean towards resiliency and hope, self-efficacy and self-esteem. I understand that young people often have depression and anxiety. I mean, being homeless is itself traumatic, and the need for mental health is there. So a lot of that would come up, and it is important, they said, but this young person, like many other we spoke with, reinforced the importance of more strengths-based, asset-based measurement as the primary focus. So when we come to the measures on social-emotional well-being, you'll see that we had a bias towards strength-based outcome measures as we were making those selections based on the feedback. With respect to education, the number of stakeholders that said that it's not only important to measure enrollment, which is what we often get, like enrolled in a GED course or something along those lines, but ultimately young people said that it's important to capture attainment so that we actually know if young people are making progress along the educational continuum. But they also said it's important still to look at enrollment as a first step and other earlier steps like attendance. So you'll see in the way that we frame up these outcomes and measures that we've selected some measures for those first steps, especially for very short-term programs to be thinking about. But we kept our eye on the ball that consultation said was important, and that's that young people are making progress in attainment of educational skills or qualifications. And then with respect to employment, just as one third example, young people very often said, look, it's just not enough to have a job. And this is often what we measure in programs, is whether young people have a job or don't have a job. Young people have reinforced the importance of having more than a job. And in fact, we see this in our data. Many youth actively experiencing homelessness also have a job, but that job is not sufficient to support sustained exits from homelessness. What young people want is to get on a career path, and many stakeholders reinforce the importance of focusing primarily on measures like income as proxies for the what is assessing change and whether the quality of the employment is improving, not just a simple outcome measure like having a job or not. So when you see this table, this table is really the heart of the project and what we work towards. And this table is available on the Youth Collaboratory website. It's hyperlinked so that if you click on any of these outcome measures, you'll be able to get more information like the information that Megan had shared earlier. And Megan's just, thank you, Megan, providing the link at the bottom of the screen here. And this table includes information on, first on the left, what the outcome is. So that's the outcome construct that we've prioritized for each outcome domain. And then to the right, we show the measurement tool or the instrument that we propose be used more consistently across the field to capture that outcome. And then under the third column, we indicate whether it's a core measure or a going further measure. So as a core measure, if we're proposing that that measure be used consistently across the field. And that doesn't mean that folks should stop there. Many programs will have their specific objectives. Maybe you're really focused on permanent connections, for example, and you might want to include several more measures on permanent connections. That's totally cool. You should definitely do that. Or maybe you want to capture outcomes that aren't within the USICH 4 core outcome areas, like physical health or exposure to violence. That's totally cool. You should do that if that's a program priority for you. But what we've included here is a set of core measures as minimum indicators so that we don't have the Wild West that Megan is talking about. Everybody's collecting consistent measures, at least around a minimum set of outcomes and measures. So that's what we're indicating with core outcomes. And then we indicate the number of items included with each one to the right. If it's a going further measure, that means it's a good measure. There were a lot of reasons to elevate it for your attention, but maybe it was a little bit on the longer side, or maybe the resources in the literature weren't as useful as we wanted them to be for helping you to implement those measures. For different reasons, we might not have included them as a core measure, but we still thought they were worth your attention and could still be useful to you. So for stable housing, we identified two core outcomes and one going further. One of the things that young people had consistently said is that homelessness or housing at a snapshot in time doesn't tell you really about housing stability. And we needed to take account for young people's fluidity in and out of homelessness and between different housing situations. So we include two measures here so that we get a better perspective. One measure is very consistent to what's already being used in the homelessness management information system, data standards that run in homeless youth programs and funded by HHS and HUD-funded programs are using. It's an exit destinations, but we've revised it so that just a little bit so that you could collect that information when a young person comes into a program, you could collect it again when they exit, and then you could collect it again at follow-up. So we tried to make sure all the measures were set up so that you could repeat them. They weren't just program exit measures, but they're measures that you could collect over time so you could actually track progress over time, and you could do that as long as you wanted to. So we made some slight revisions, but that measure is just about the current housing situation or destination, where a young person's sleeping or where a young person is going to exit from a program. That doesn't tell us much about young people's stability over time. So we also added an item called recent housing and stability. It's a very brief measure that we developed looking at the literature and drawing on people's feedback in the consultation, which looks at young people's housing situation over a 1-month period, over the last 30 days. And it looks at different forms of homelessness and housing instability so that you get a better picture of whether a young person has in fact remained stable. If you want to administer that question, for example, 3 months after a young person has left a program, you get a better idea of whether a young person has continued to experience housing instability or not. And then going further, we suggest the residential timeline follow-back inventory. That's a mouthful, I know. That would, in many cases, be seen as the gold standard in the research field for assessing housing instability over time. It's a cool tool. It's a great instrument because it allows you to conduct an interview with a young person that, say, captures where they stayed over a 6-month period and how many days or what percentage of days over that period of time they were stable or housing unstable. And you can collect other information about what types of housing arrangements they had. So it gives you much more information, but there aren't really standardized tools, and they tend to be interview-based, which can be a little bit more complicated or limiting. So for now, we've put it as a going further measure that some of you might want to look at, and we think it's worth further investment of research and time into developing a version of this tool that could be standardized more across the field for youth homelessness and maybe made a core measure in the future. For permanent connections, the main feedback that we got from the consultations was that, A, it's not enough to just have the presence of a caring adult, which is how the RIE HMIS data standards currently measure it. Many young people could say there's the presence of somebody in their life. Maybe it's a social worker, maybe it's somebody in the community. But often these young people are used to experiencing relationships coming in and out of their lives, so it doesn't really say anything about the stability of those connections. And young people said we can get positive support from many different sources. So they wanted a measure that captured different types of positive connections, instrumental, practical, emotional, and so on, and captured that type of support coming from different possible sources in their lives and not just, say, a program worker or practitioner. And in fact, that should be the goal of programs, is to help establish positive connections that don't depend on young people's program relationships. The permanent connections measure that we recommended in light of that feedback was the social connections measure that's provided through the Youth Thrive survey developed by the Center for the Study of Social Studies and Policy. It's freely available. It has 17 items, but you can move through them quite quickly, and it captures different types and different sources of social connections. There's also a longer instrument that we highlight. It was primarily designed for youth transitioning out of foster care, but would largely be relevant for youth experiencing homelessness as well, maybe with some minor tweaks. But it's a longer scale, so we did not suggest it as a core measure, but it might be one that's useful for more in-depth conversations and measurement around social positive connections with young people for programs that want to go deeper in that domain. For education, coming down one further, one of the things, as I highlighted in the example quote before, is that young people said, it's not enough to be enrolled in attending school that's or an educational program. That's a good thing to capture, but we want to know about whether we're making progress in attainment. And that could even mean grade level attainment. You don't have to wait 4 years necessarily to capture different levels of attainment, but that is ultimately what programs and service providers are working towards in capturing and measuring. So we developed, kind of modified a simple tool around capturing whether somebody is enrolled and attending, enrolled and or attending a school, I should say. And we tried to make that broad enough so that it could apply to secondary school attendance as well as participating in higher education or a certificate or a different degree program. And then we also include educational attainment based on the American Community Survey measure, which is the U.S. Census Bureau's measure. So the nice thing here is that it's a widely used measure, not too hard to administer. It's been well developed. And the data you collect from this educational attainment measure could be compared with youth across the country using U.S. Census data. So that's a strong advantage. And going further, consultations also highlighted the importance of chronic absenteeism as an early warning indicator for young people, particularly in secondary or grade school. So that's why we didn't include it as a core measure, because it doesn't necessarily apply the same way to the full age range that we're capturing. And it can be difficult if programs don't have good data sharing agreements, for example, or relationships with the school system. So it can add additional complexity, but we know it's an enormously important early warning indicator for young people experiencing homelessness or at risk for homelessness. For employment, as I mentioned before with the example quote, young people said it's not enough to just have a job. And so we retained the RAI HMIS data standard around income, but we adapted it a little bit so that if you're already collecting income information through HUD funding or HHS funding, continue to use that measure, it's fine. But if you're not already participating in HMIS, we simplified it a little bit so that you could still compare information at the high level, but it doesn't go into the same breakdown of, say, income from public assistance or many of the categories that didn't apply as much to young people and would take more time. So it's just two types of income: earned income from a job, which could be wage employment or self-employment, and any other income source. So it's just those two categories. So you can add them together, you can look at them separately, but we thought that was important to separate out earned income and to be able to look at that. And then second, we still kept employment status, but while many programs ask a question like, do you have a job or not, in the national economic space, that actually means very little, because you can ask whether somebody has a job, and that might mean something very different to one person than it does to another person. And there are actually very well-defined ways to assess employment status in terms of employed, unemployed, out of the labor force, part-time employed, and so on. They're very well-established definitions and metrics for that, used both in the country, here in the U.S. by the Department of Labor and others, and internationally. So again, we use the U.S. Census Bureau's American Community Survey type of approach to measuring employment status, so that the way that service providers working with youth experiencing homelessness are capturing this information is consistent with national labor force norms about how we collect information on employment. And we also think it'll give you a little bit more detail that will be useful for you and the young people about what that employment looks like, and having conversations with the young people about what they want to aspire to. And then there's a third indicator here. And this one is not actually a measure, because it is simply about combining the information from the employment status question and the enrollment and attendance item or measure. The reason this is important is because it captures whether young people are what some would call disconnected youth, or not in education, employment, or training, NEET. This is an internationally collected measure, and the U.S. Department of Education supports this measure here in the U.S. as well. It's important because you might have a young person who leaves a job to go into an educational program, or leaves an educational program to go into a job. And without taking those two forms of information into account together, we might assume a failed outcome, when in fact a young person is just advanced in their, say, career trajectories, or they have decided to take a break from employment in order to go into education for better career prospects down the line in the future. We don't want to penalize that, so creating an indicator like NEET, or disconnected youth, allows us to assess whether young people are outside of all of these systems, or if they're participating to some degree in education, employment, or training. And then the final domain is perhaps the hardest one to be able to look at, because it includes so many different things. People define it in so many ways. And that's social-emotional well-being. The main thing that we heard from young people and stakeholders here is that it makes sense to focus first and foremost on strengths-based measures to capture young people's assets and resilience. And the second thing that we heard is, because social-emotional well-being includes so many different dimensions, from self-esteem to mental health to social-emotional functioning, it makes sense to not just rely on one measure to be able to gauge whether young people are progressing on social-emotional well-being, but to capture at least 2 or 3 measures to get different glimpses into how young people are doing. So what we've recommended as the 2 core measures are the mental health continuum short form. The nice thing about this one is it's a strengths-based orientation to mental health. It is based on the premise that mental health is not the absence of mental illness, just like physical health is not the absence of disease, but mental health is about well-being and resilience, and so it provides a more strengths-based, well-validated measure for mental health with youth. The Youth Resilience Scale is a lot like a self-efficacy measure, in that it focuses on young people's internal resolve and ability to overcome challenges and adversity, and it also comes from the Youth Thrive survey. The other measures that we suggested for going further include the Kessler 6 out of Harvard. It is probably the most validated and widely used mental health screening measure for mental health problems like anxiety or depression, used in the U.S. and across the world. It's only 6 items, so it's really very short. And this is the one that's not strengths-based, but many programs still want to screen for potential mental health disorders that might require follow-up assessment and support, and it still captures a score, so you can still assess progress in reducing mental health problem symptoms over time as an achievement of the program. So this is one that we put forward that could be used. In addition to that, some folks might want to use the full Youth Thrive survey instrument, we've included 2 of the 5 measures in the Youth Thrive survey as core measures. One is the social connections measure above under permanent connections. The other one is the youth resilience measure. But it includes a few others as well. And having young people take the full survey with all 5 measures really only takes on average about 10 minutes. And there's an online ecosystem. It's free to use. Nice thing about Youth Thrive survey is it's been specifically developed and validated predominantly with youth of color and LGBTQ youth using community services, much like the ones that many of you administer. So it's brought more of an equity lens into the development and validation of these measures. So some of you might want to just go ahead and implement the whole Youth Thrive survey instrument, and that's available to you. Also, many programs collect information on life skills. Many of you have programs on life skills. The reason why this is, we put the Ansel Casey Life Skills Assessment Tool here. This is one of the most common life skill measures out there, probably the most common one, and many programs are already collecting this information. But the reason that we included it here is for a couple of reasons. One is because life skills include some dimensions of social emotional well-being, but it can also include things like competency with cooking or financial literacy or lots of other things that don't neatly fit under social emotional well-being. So Megan had mentioned relevance in the domain as being really important, and it didn't quite fit there, so we put it as a going further. The other reason is because it's a fairly long instrument, 113 items. There is a shorter 20 item measure that some might use, but given that we thought this made sense for programs that wanted to go deeper and assess progress on life skills, but not necessarily as a core measure right now to recommend for all service providers to implement. So I'm going to just say, as we go into the, oh no, this is where Megan comes in, I think.
Yeah, sure, Matt. Before we move on, I think there are a couple of questions that have come through the chat that would be helpful to answer now, and then we can move into adoption strategies and considerations, which I know is really pressing for people. But specific to the measures, Norma asked about how the tools are scored, or if not scored, how do you compare responses over time? Are they aggregate numbers per measure / category, or response to response?
That's a great question. And if you click on the hyperlink for any one of the outcomes, it will provide the summary overview, the cover page that Megan had showed earlier. And that answers the question about how each outcome measure is scored. And it's a little bit different for each one, so it's really important to look at that information for each one. Some of them include just an overall scale. So for example, for social connections under Youth Thrive, there's a Likert style set of response options, which means it might look something like, you know, do you feel like you have somebody that you can rely on for help? And then it would include, you know, 5 response options, something like that feels a lot like me, a little like me, somewhat like me, not at all like me. And depending on your response, it's scored from a 1 to a 5. And then that summary score for all 17 items is added up, and then there's an overall sum score. And you can track progress in that. You can look how an individual young person matches up with the social connection scores of other young people in your program or your community. So that's just one overall score. In other cases, like with the Kessler 6, the mental health screener for psychological distress, we know from the broader national and international data that roughly certain score cutoffs indicate thresholds for potential mental health difficulties or problems. And so that can be there can be flagged scores that you might be particularly concerned with and might warrant follow-up assessment for potential diagnosis and treatment. Or maybe as a program, you're trying to make sure that, I don't know, something like 90% of young people who come in with mental health symptoms or above the threshold are moved by the end of the program to scores that are below the threshold for potentially clinical psychological distress, just as an example. So some of these involve scores, some have some thresholds based on normative data, and some are more of like yes or no. So like the recent housing instability question, if a young person said yes to any one of the items indicating housing instability, then it's not necessarily a score that you would use. You would just indicate that as X percentage of young people, or this young person has continued to experience housing instability when you follow up.
Thank
and
you,
I see
Matt.
that Megan is showing an example of where this information is provided for each measure.
Mm-hmm. Yeah, exactly, Matt. So I just tried to pull up an example of the cover page, and here is where you talked about that in this case, the Kessler 6 actually tells you what those scores mean or has recommendations on it. Does that answer, Norma, does that answer your question? The full tool completed and then compared to a second administering. Thanks, Norma. We're going to continue to capture questions in the chat, so keep them going. We're organizing them by the areas that we are have discussion set up for. So let's jump into adoption strategies and considerations. And to kick off this section, and then I'll hand it back to Matt to talk a little bit about timing and frequency, a couple of things to mention here is that you don't have to do this all at once. You don't have to integrate every single one of these measures. You don't have to do it across all 4 outcomes at once. Think about it more like an adoption path or journey. So where are there low-hanging fruit, things that are easy to change now versus longer term? And for some of you, you may see that you're tracking these measures already, particularly the ones that connect with HMIS or just have a couple of slight tweaks from HMIS. And it's important to note that there's no one way or right way to go about administering these measures. So really, we can help provide prompts. We can answer questions. Together, we're going to share some ideas moving into the next phase of the webinar. But know that each program system organization are on a different path. The commonality is these core outcome measures. Matt, do you want to talk a little bit about timing and frequency?
Yes. So this is a question that we get a lot. When and how often should we capture these measures? And as I mentioned earlier, one of the things that was really important for us in determining which measures to use or in making some adaptations to measures is making sure that these weren't specific to using at just one time point, like a program exit or a program intake, but that you could repeat the same measure over time so that you could capture trends on how a young person starts and how a young person does over time in response to the programs or the systems working with them. So it's important that young people have these measures integrated into at some point in their intake. Now, this is a choice that would make sense for programs and organizations to look at somewhat individually, but for some young person that might not need. For some young people, that doesn't necessarily mean the first day, the first hour that you meet them. Maybe there's an initial crisis conversation that you're having, a triage conversation, and often maybe a follow-up conversation with a better intake process and more detailed assessment where these outcome measures could fit in. But the importance is that early in your contact, your relationship with this young person, that you're including these outcome measures for two reasons. One is because then you can use outcome measures in the service planning, thinking about what other programs or services might I link a young person with to be able to achieve these educational outcomes in greater ways if that's not a service we provide, or how can I help a young person achieve greater housing stability or make more positive permanent connections. And having these outcome measures embedded in your intake process creates that opportunity for using outcome measures as a basis for dialogue with youth and what they need, and not just thinking about what one program offers, but thinking about the youth needs first and what's in the community, if not the program, that could support them. Also, it's important to include intake because that gives you a baseline. You can see how young people are doing when they first come into the system or the program, so that when you track how they're doing later, if you see that 80% of young people are employed, well, if 70% of them were employed at the outset, that's not as meaningful as if 30% of them were employed at the outset, but you wouldn't know that unless you capture that information at baseline. We also think it's important to measure the information at program exits, which is something that many programs are used to doing, but not stopping there. And this gets logistically difficult, but wherever possible, to build in opportunities or junctures, maybe 1 month out or 3 months out or 6 months out from young people having exited a program or system, and finding creative ways to follow up with those young people to see how young people are doing over time, and whether they're holding the progress that they've made when they exited a program or not. Then looking at average length of stay and aftercare engagement. Engagement matters. Where there are opportunities to make a slight change with the current service flow, you can do that if you're capturing outcomes information over time. So if you continue to track this information, whether it's 3 months out or 1 month out, it allows you to adjust service planning accordingly. So we're interested in hearing from you. Which of these measures are you most excited about, or which of these measures can you imagine your program or organization integrating more immediately or in the short term into your practice and your data collection?
And I just want to point out for people, if you you can click directly on your screen here. Great, welcome. It looks like it's starting to slow down a little bit, like most people have filled in. Go ahead, we'll give you another minute to fill those in. This is really exciting to see the number of programs and organizations who are considering all 4 at once. And doing them all at once. Great. While people finish filling those out, Matt, do you want to take this other question that Nicole came to the webinar with
Sure. Which is the question, Megan?
Yes, no, sorry. I thought it was about choosing and integrating measures, but I'm questioning that now. We'll ask it anyways. Nicole asked, what are the strategies for collecting meaningful data in a drop-in center where youth might have been coming for years or may just come a couple of times and then never come again? What are some strategies there?
It's a great question, and often when we're talking about these measures of programs, the example that's raised is the sticky one is usually drop-in center, because those are often about short-term contacts with many young people, and then other young people, as you say, might be fairly regular contacts and coming often to the center. So it's really variable on the types of opportunities that you have to engage those young people in meaningful assessment. I don't think there's just one way to answer this. I think it's a learning conversation for drop-in centers in general and to learn from each other. Some of the drop-in centers that I've worked with, don't have, they try to have an intake assessment interview with all of the young people, as many as they can, but it's often not in the first time meeting, but they will try to schedule a young person or find a time in that visit for later in that visit for a young person to sit down with a caseworker and have a fuller intake conversation to think about service planning and where they are. That's probably, if your drop-in center is doing that or considering doing that, that could be a good time to start collecting that information. If you don't have those types of opportunities with young people, you might just not have enough time to collect meaningful outcomes information, and maybe the drop-in center is not the appropriate place to do that. But once a young person is linked from a drop-in center into slightly longer-term intervention, that then becomes the opportunity to start tracking their outcomes with these types of outcome measures rather than just service contacts or something like that. So it depends a little bit on the program structure of the drop-in center and what the current opportunities are, and also how the drop-in center is linked to other programs. If it's by itself, then the drop-in center might be the only place in your community where you have a chance to get this kind of outcomes information on youth, and you want to use that opportunity. If the drop-in center is the kind of front door to other programs, then it might be that those other programs can integrate these outcome measures more meaningfully when a young person enters those programs. So it's a localized conversation to some extent, and we're really eager to learn from communities about how they're doing this.
Thanks, Matt.
Megan, would you say anything differently?
No, I don't have anything more to add there. Let's move into, though, sharing a little bit more about determining the how and the why. And please do continue to add your questions into the chat box, and we'll continue to answer those. So the first thing we wanted to share here is that the recommended measures are both tools for service coordination as well as program evaluation, right? So a little bit about how this happens. In some ways it can be moving from these can indicate areas where you might want to do more thorough assessment, for example, where you might want to do either a going further measure or another type of in-depth assessment that is integrated into your program already. Other ways that these could be useful is that you can begin to see what the mix is across the various measures. Okay, so we're seeing high strengths in permanent connections and really low scores in social and emotional well-being. Let's concentrate our services in building up the social emotional well-being, or let's concentrate on utilizing those permanent connections to help strengthen the stable housing area, for example. Likewise, in evaluation, you can start to see trends where you start to see trends in differences or changes in those scores or outcomes. over time with the individual young people or as in the aggregate across your organization. It's important to note that as if you're using this as a service coordination tool, when and where you use it is important to both establish a baseline intake and to track those changes over time. I think somebody asked this question: how are the tools tracked and how often are they administered? That's the cool thing about using these common measures, is that you can first implement it at baseline, in some cases during services, and again at exit and even post-exit. Matt, is there anything that you would add to that specific point? I hear you talk about this a lot.
No, I think you put it really quite well. I would just say that you could have the most valid and reliable outcome measure in the world. And if it's not collected in a way or administered in a way that is valid and reliable, then the information will no longer be credible or useful. So it's really important to keep that in mind. Sometimes we just focus on the measure and not the process of administering the measure. So for instance, if you're capturing information from young people in a place that, or a space that doesn't feel safe or confidential, or if it's not culturally appropriate, if it's not in young people's language, or if a young person feels more comfortable completing information on a survey than through an interview or vice versa, and the process doesn't respond to young people's needs there, then the information is just not going to be as good, even if you have a great measure. So it's really important to have a conversation as an organization that's very intentional about how you can best administer these measures in a way that's practical for you and your programs, and is also thoughtful about how young people can complete this information the best that they can. And we strongly encourage you to involve young people themselves in informing those decisions.
Yeah,
Matt, Megan, I would just want to add, I think another way of thinking about what Matt just shared is for programs that have opportunities for longer-term engagement, what is the opportunity to do some of that phased assessment to establish some of that baseline, thinking about what information is critical to set up service coordination and rapport with young people that can happen within a week, 10 days, 14 days, thinking about what the setting is and what the opportunity is to build rapport with that young person prior to asking them, administering those measures.
Thanks, Josephine. I think in some ways that covers the third bullet here in how this, in determining your how and your why, aligning that with your larger continuous quality improvement strategy at the organizational level. This is just one piece of the quality improvement, and will provide the data and evidence for analysis. But the analysis piece is where those program improvements would happen. And we would ask how are youth, particularly youth with lived experience, involved in evaluating those strategies. And then finally, and we'll talk a little bit more about this as we move on, what are the training and supervision strategies that are critical for staff administering the tool? So just as Matt was saying, you can have the best, most evidence-based, validated tool out there, and if it is not administered correctly or well, then suddenly it impacts the usefulness of that data. So speaking of that, we'd love to hear a little bit from you all about the training or supervision techniques that your organization uses to support staff administering measures in your program, right? So you're already out there using measures existed before this project. What are some of the things that you've learned along the way around training or supervision techniques that supports your staff in administering measures well? You can type it directly where it says type your answers here, and we'll broadcast those results as they come in. It looks like we only have one answer so far. Okay. Oh, good. We have a few more. Contracting with a local university. New to this work, so just measuring housing stability through length of stay. A learning and evaluation team that holds trainings and follow-ups to direct service staff. Quality assurance committee. Peer data file reviews to ensure completion and collection. Right out. Let me open this up so we can see those all at once. Matt and Josephine, I wonder if you have any additional things that you would add to this list here as we read through it.
Yeah, I'm curious if anybody on the call also uses the help of young people in their programs to help practice using the tool and getting feedback about, again, the how and the why. And I love seeing some of the team approaches for that peer review and peer training. I think it's so critical to gain some consistency at the program level, but also be able to do some real-time feedback with each other. Matt, is there anything that sticks out? Yeah.
I think Josephine made a great point, and I totally second that. One thing that some programs are starting to experiment with, and we're seeing used much more now in school systems and in research and evaluation, is mechanisms for youth to self-administer outcome measures. The traditional practice is to administer outcome measures through interviews or case management sessions, and that has some advantages, and some young people feel comfortable with that. But what we found in the research is often young people feel more comfortable. They feel that their information is more confidential if they're self-administering brief surveys through tablets or computers or even a smartphone. So we at Chapin Hall often develop surveys using those types of platforms, and that actually makes data cleaning less monotonous, data entry less costly, and many young people prefer it. Not all young people, but many young people prefer it, especially if you can include an audio component. So they see the question and it's also read to them through earphones or something like that so that they can hear it if they're at a lower literacy level. And so that's just not going to work for all programs or not be feasible for all programs, but it's an emerging movement, I'd say, in the outcome measurement space with programs to consider.
Mm-hmm.
Great, and I think folks speak to it through some of these responses, but the onboarding of staff to really understand why the measures they're using are the ones for their program and how it aligns to their logic model and their aims, I think is just as important as understanding the sort of functionality and the technicality of what the tool is, and humanizing the measure from the beginning, and understanding that. And I know this is sort of naturally embedded in our work, but there's something very important about explicitly humanizing these measures in a way that links the staff that will be using them to the work and the partnership and the relationship that they're building with young people.
Thank you for that, Josephine.
Mm-hmm.
Shall we move on to follow-up?
Yeah, let's do it. Great. So the last sort of adoption strategy and considerations we wanted to touch on today was just around follow-up engagement, recognizing that both in addition to entry and exit, that as programs and at the systems level, we want to do a better job of tracking changes over time for the population served in the community. And this was really critical in the consultation group, talking about the importance of both not tracking change over time for young people that successfully exited or successfully transitioned from programs, but that is just as critical to stay connected to young people who don't successfully, and I'm using quotes there, transition or exit. But we recognize that there are limitations to program and system level evaluation when it comes to follow-up, recognizing the capacity of an individual program, the limited investments in evaluation as part of program and system budgets. But we know that across the country, different strategies around follow-up is happening. So we had two polls that we want to use. But before I get into that, I just wanted to speak more to how important the relationships that young people are able to build and rely on at the beginning and while they're in the different programs is critical and actually supports the ability to do follow-up. When young people know that staff and program-related folks are just part of their life success, they're more willing to follow up when you reach out to see how they're doing after they've left the program. And we also know that where youth are able to visit or to come back to really supports the ability for programs to do follow-up. And I think what the distinction I want to make here is not that they can just show up or reach out, but that relationship is related to the lives that they're living post-program, that is in tune with the goals and the aspirations that they have, not as program participants, but just as young people living their best life, or just continuing to work on their stability once they've left the program. And that the more programs can create that space and create that expectation that you can do a visit, you can come back, you can reach out, we see more like increased ability to do some of the follow-up engagement to track that longer frame of changes over time. And we want to continue to support and push programs to think about how they can stay connected or have the ability to follow up with young people who do not successfully exit or transition. It is just as important as a field that we are able to improve on our interventions, improve on our strategies for those young people who continue to fall through the gaps, and hold ourselves accountable to what we can do together to improve the outcomes for those young people. And what we know is that the more young people are centered in thinking through and designing those strategies around evaluation, around longer-term engagement and creating space for young people to come back, that we can strengthen our strategies to do so, because we know young people just will always have a better connection to their peers. They will know where they are. They will know how to find them. They will know how to engage them. And they're just more creative and more real and transparent about how to do so. So where we can continue to invest in young people as designers of these evaluation strategies, where we can continue to invest in young people in positions where they are helping programs and systems reach out and stay engaged, we really want to support that strategy. And so I'll pause there. We want to hear what programs are trying now, what types of strategies they use now. So Megan, I believe our first poll is just getting a sense of what programs are doing.
Mm-hmm.
Great. So we would love for you to head over to the question, what techniques does your organization currently use for follow-up? And if there's a strategy that we haven't named, please include it in the chat box. We would love to see what staff are, what programs are trying. So we've got incentives. We've got no one using social media at this time in the poll, so I'm curious about that. Oh, there we go. Surveys, dedicated staffing to do the follow-up evaluation. Curious if anyone uses like in-person engagement strategies. We know about pizza parties or movie nights or job fairs that also build in opportunities to check in on outcomes. For those that clicked other, would love to hear some specific examples. Of course, longitudinal studies with local university. I love it, Robin. Robin said, why is it only one choice? I need to do 4. Yes, amen. This poll is just to get a sense of what communities are doing, but love to hear that you are utilizing and leveraging all strategies to stay connected to young people. Awesome, Robin. We'll just give folks a couple more seconds.
Josephine, I'm sorry. I think I just messed that up when I tried to allow people to give multiple answers.
Oh, that's great. Oh, that's okay. I think knowing that there are multiple ways of doing this is just as critical as seeing maybe what strategies are being most commonly used right now. So thank you. Great. And engagement activities, if folks clicked on those, would love to see what types of engagement activities they use to stay connected to young people. Oh, we've got multiple people responding, so we'll just wait a second. But I think we can go ahead and end the poll, Megan. Thank you. And I'll just circle back again with the current strategies. We've had great success with community strategies. Robin, thank you for adding that. I think that's a great way to build community, a great way to connect with young people that's not about their service coordination, and a fantastic strategy to implement some follow-up. Christy is crowdsourcing. Curious to know how people are getting surveys to past participants. If you are an attendee that clicked on that option, please share what you are, how you're getting those surveys to young people. Danielle, so I'll speak a little bit about what I know communities and programs are trying, and would love for others to share their example. So Danielle asked, can you discuss social media strategies further? Absolutely. So what we know and what young people continue to tell us in our work at Youth Collaboratory is social media is a great strategy to create community, to communicate information, to share resources, but also as a way of creating a feedback loop for programs. So I think different organizations have different policies around how to set up the use of social media to stay connected with young people. And young people are great designers in helping set up what those social media strategies, but that can include Facebook, it can include Instagram. There are so many new apps that are available for young people and for folks just to create community and stay connected. And I think it just should, of course, be aligned with your continuous quality improvement policies and your boundary policies. But that is where young people live. It is so accessible and quick opportunity to get sort of really quick feedback, but also to ask for help in getting follow-up information. Matt, I don't know if you want to add anything to that with some of the work that's happened. been through Chapin.
I think that covers it quite well, Josephine.
Great. All right, so thank you for posting the part 2 of our question. Would love to know specifically what techniques are you currently testing? We know, like all the work we do is iterative, and wondering if there's any specific efforts to improve on follow-up evaluation with young people that folks are trying out that would be willing to share. So go ahead, type in your answer in the box, and it'll show up in our results.
Josephine, I'm really excited to see all of the activities that people are currently using related to follow-up. It seems like there was a flurry. This is an area that on our last call, there were quite a few questions around follow-up and how do we continue to keep young people engaged, if that's your objective, so that we can do follow-up surveys at the 3-month mark and beyond for some programs. So it's exciting to see the level of effort that's being put into here.
Great, so we've got a few responses coming in. Youth Action Board, would love to hear more about that, but for folks that have an existing Youth Action Board, that is a great place to ask for support in designing and structuring engagement strategies to stay connected to young people. I love that our Youth Action Board is pretty good at convincing their friends to do follow-up. Again, those peer-to-peer relationships are extremely powerful, and if we can invest in young people to help us understand how to support those relationships, but also ask for help in those relationships supporting the programs, I think we are all better for it. Community dinners that alumni attend and additional events and activities. Thank you so much. This is great. So I think this speaks to some of the best practices that I shared earlier. Building community should not just be about the service coordination and impact that happens at the beginning and end of a program, but that it's really just a natural part of how young people transition into adults, and it's how we adults to continue to sustain our well-being. And so that to the extent that we can do that both within our program walls, but also in the context of the communities that we live in, those are great opportunities to stay connected to young people. Thank you so much for sharing those examples with us. As we transition to talking about follow-up in a little bit, I think we hope to integrate that. But before then, let's pause and just answer a few more questions. Megan, is there a specific place we want to start in circling back to some questions or just opening it up?
Yeah, so we have some questions that people walked in with that have yet to be answered, or maybe weren't answered in the pieces that we've already talked about, but I'd encourage you to continue to put your questions in the chat box as we go through these in case we missed one or two. Eric, you asked a question of if everyone buys into this methodology, how will results be compiled and reported collectively? How do we harness the efforts of various service providers? It sounded like that is a goal, but how do we get there? That's a really good question, and we were going to do this after questions, but I think it warrants mentioning this here before we continue to get down into the weeds. There are, this is where we see the path forward. So this is an important first step in defining these measures, but that's exactly what it is, just a first step. The things that we see as the path forward, the first is around providing operational guidance to organizations around administering and particularly also around augmenting your data instruments, so helping people, supporting organizations in implementing the measures to begin with. And the second piece is around piloting and assessing integration, right? Our ultimate goal is to develop or refine these measures over time and aggregate and analyze this information across communities on a national level. To get there, the first step is piloting and assessing integration, being able to make those tweaks to that guidance once that is created. We have a commitment to those of you who are on the webinar to follow up afterwards. We're still working out the details and how individual organizations can pilot these measures. So you can pilot them on your own without our help, but I think your question, Eric, more around aggregation. If you are a part of some initiatives that we're already working with, you'll have some specific instructions that will come out of those initiatives. If you, and for those of you who are not connected already, we will email you sort of the path forward and how you can connect to us as you are piloting these measures and draw on support while you're doing that. The aggregate part will also be integrated into that. Josephine, was that clear?
I think it was, but if folks have questions, please share those in the chat.
Mm-hmm. Great, thanks. Alice, yeah, I was just moving on to your question there about how do you view the timing if a youth doing a TAE VI SPDAT and the instrument for core measures, how do you recommend timing those two tools together? Matt, do you have thoughts about that?
Remember that the purpose of the TAE VI SPDAT is not for assessment, it's not to capture outcomes information. It's meant for the purpose of triage. It's meant for the purpose of prioritizing people in crisis for limited resources when you have excess need. And so it'd be like somebody coming into an emergency room in a hospital. The first thing you do is that triage. And so the TAE VI SPDAT would make sense to include first because you're making that initial triage determination. That's the purpose of the tool. And then to follow that up with a better conversation around how that young person is doing, where they're at, which could include outcomes measurement using these measures. In some cases, that might be able to take place in the same conversation or the same intake assessment, but in other cases where that triage is taking place in a very quick and crisis type of model, then that intake assessment, including outcomes measurement, might include or might take place in a follow-up meeting or discussion later that day or maybe the following day or later in that week. So it depends a little bit on your program and your system setup. If your system, your community system and organization does not have a time and space for a meaningful intake assessment process that could include standardized outcomes measurement, we'd encourage you to find a way to build that into your process and your interactions with young people. Otherwise, it makes it impossible to track outcomes and to have that service planning conversation based on where a young person's outcomes are early when they come into your program or your system.
Thanks, Matt. Josephine, do you want to take the question from Christy here? She asks, how do the intakes in various surveys line up with the Housing First model, where it seems you cannot require any of that or even require case management?
Yeah, absolutely. So for folks who may not know on the call, Housing First is a belief that a person does not need to be ready for housing, and that it is them being in housing that creates the platform for that longer-term change. And the approach prioritizes meaningful engagement with, and for us, with that young person over program requirements. That said, the tension is real between how to practice Housing First every day in an authentic way, and also hold real and meaningful accountability and expectations of young people as they transition into adults. So the tension is real. And what I would say is that regardless of if a program is aligned with Housing First, these are outcomes that young people themselves have named as important for their growth, their well-being, and their ability to thrive long-term. And that even in the context of programs that have requirements around case management, requirements around program engagement and participation in activities, that does not simply result in the outcomes and the measures that we have recommended, that it still requires that authentic engagement with young people, or it still requires building up your toolkit with stages of change and motivational interviewing and harm reduction and trauma-informed care, right? All of these different frameworks that really help us see young people for who they are, meet people where they're at, but also create that pathway to helping them succeed on the aspirations that they named for themselves. And when those aspirations reflect these measures, that we all have a very a common way of documenting that. So I say that to say it's a real tension, but it doesn't change that these are the measures that young people, whether they're in housing or not, are striving for, and that our opportunity is to use all of these tools to engage and move them on the path forward.
Thanks, Josephine. Matt, I'm going to pass the question from Alice that came in with this question. Would this tool be appropriate for a state juvenile justice agency to adopt to measure their outcomes?
I think it should absolutely be considered for other systems. We were focused on programs and community systems serving youth experiencing homelessness because that was the objective. But the outcomes and measures that we include are not specific to youth in one system or set of programs. So they absolutely should be considered in other systems and agencies. And in fact, many of the measures that we incorporated were initially developed and used with broader systems and programs serving vulnerable youth. So I think the answer is yes, that should absolutely be considered, and that allows for even more comparability not only within the youth homelessness space, but also across systems and services.
Mm-hmm. Great, thanks, Matt. That is helpful. And then for either one of you, how transferable are these results or strategies across specific subpopulations, for example, LGBTQ, homeless youth? What recommendations do you have for adjusting evaluations for specific populations?
We tried as much as we could to identify measures and assess measures based on their validity and with populations that include youth of color and LGBTQ young people. But as you might imagine, for many measures, validation work just has not been done with specific subsamples like that. So it's a limitation to be aware of. And I think we as a field, as we continue to use these measures, can collect more information, both scientifically in things like validity testing and in terms of your experience with other populations that you serve on how well these measures are working for youth of color and LGBTQ young people. There's no evidence to suggest that any of the measures we've selected wouldn't be valid for those populations, and some, like the Youth Thrive measures, have been tested already with youth of color and LGBTQ young people and showed good validity and reliability. But there are things that you should consider in the administration of these measures to make sure that they hold up well for different cultural subpopulations that you serve. That might include, for instance, if these measures are being administered by a caseworker or an interviewer, that might best be done by people who share the racial or ethnic identity of young people that are the respondents, or if you're working with LGBTQ young people, just like LGBTQ peer counseling, might be done best with young people who share a sexual orientation or gender identity. In some cases, you might look at ways to do that as well in the context of outcomes assessment. So just something to consider. And getting feedback, as Josephine mentioned earlier, from youth from different cultural subpopulations about the best ways to administer measures in ways that are safe and sensitive for young people with their identity.
Mm-hmm. Thanks, Matt. I think that is all of our questions. Margaret came in with the questions asking where there are opportunities for testing implementation of these measures with other initiatives such as the Grand Challenge. But I don't know that that question necessarily needs an answer.
I would just speak maybe, Megan, to Alice brought up a follow-up point on burnout. And, I think that's real, and we've heard it with youth in the consultations that we've done for this. And then my colleagues and I at Chapin Hall have recently done a youth homelessness system assessment here in New York City, and we heard a lot from young people about, just having to go through the same set of questions or different questions, but having to be re-interviewed about their experiences all the time, every time they had a new service contact. Overall, the intention here is that having common core outcome measures reduces that, because if programs in a community are lining around similar outcomes and measures, and if they use that as a first step towards sharing information and data in better ways, then this might not be needed as much. Young people wouldn't have to go through a whole different set of outcome measures or interviews across programs if programs are being more consistent. So that's one long-term hope. But initially for a particular program and thinking about the timing of the TAVI-SPDAT and the tool, I'd really encourage programs and communities to get young people's feedback on that. The other thing that we hear from young people is that like any of us, why would you want to spend your time answering questions that you don't think are being used to support your well-being or your trajectory towards housing stability? And if programs are just checking off boxes by including more outcome measures, then it's not really serving the purpose, and young people see through that and not a good use of their time. If you include all of these outcome measures, it probably takes about 20 minutes. We tried to find short and efficient tools, and so this is not an extensive, like 2-hour type of process of outcomes measurement. It should be fairly abbreviated, and I think it's important to explain and demonstrate to young people that you're using these outcome measures to improve services and systems, both for them at the individual level and at the program level for other young people like them. I think it's important to make that clear, and it's important to show that you're using the information from these outcome measures to get them the supports that they need in strengthening their outcomes and to make your programs and systems better. And in my experience in talking with young people, they feel better about offering their time to participate in outcomes measurement when they feel like it's actually going to be used towards a purpose.
Thanks, Matt. And Shane was just coming back asking about thoughts around using the TAVI-SPDAT for triaging youth, but his question is really around using it for determining who's most in need of housing without using the score value alone. Matt and I have actually, and Josephine as well, have done a fair bit of work around the TAVI-SPDAT, but we could talk about that offline. I want to sort of stick to the outcome measures here, and then Robin sent us back to Norma's question around RHY grants this time around. Norma's question was, we're in the process of submitting 3 federal grants, 2 basic center and 1 outreach. That's a lot, Norma. Are they expecting that these measures will be used for those? And the answer to that question, Norma, is there's no specific reference to using these outcome measures in this year's funding announcement. So where it is useful and helpful for you to meet the funding announcement criteria in each of those grants, certainly you can feel free to draw on these as they are useful to you in your grant writing. Great. Any other questions before we wrap up here today? Great. Shane, we'll send you a private chat to get that figured out. And with that, I just want to say thank you to our research team, our federal partners, our steering committee, our focus group participants, and really for you all for your participation here today and your commitment to solving youth homelessness in your community, making that more rare and brief and certainly less common in your communities. And I also want to thank the Rakes Foundation and the Melville Charitable Trust for their support of this project. I say outcomes is not always the most exciting, but the opportunity that this is creating for us in the field and in this movement, we are deeply excited about,